Community empowerment is what we call a bottom-up approach in public health and health promotion, and it means in giving people a voice, giving people an opportunity to be the center of health promotion and public health programs. And this is now accepted as a very comprehensive approach, because in the past we've just simply used top-down methods where we've directed information at communities, and that hasn't worked. People haven't changed their behavior. What we know now is if we can engage with communities and involve them in the program to help them empower themselves, the programs are much more effective. The book is written largely for practitioners, people who are working in public health and health promotion in the field, because it's a very practice-focused book. It contains a lot of case studies and a lot of practical exercises that people can use when they're working with members of the community, with mothers, with youth. But it's also a good book for training, for working with students of public health, undergraduate students, but also postgraduate students. As Italy is a frontline country for this new wave of migrants coming in, it's very important that we don't just process migrants and then ignore them. We must engage with them, we must find out what their needs are, and then we must try and include those needs as part of our programs, using both a bottom-up and a top-down approach. And in this way, the experience tells us that our programs can be much more effective. Trust is important because we want people to have a sense of ownership. We want them to have a sense, not just to participate in our programs, but we want them to have a sense of ownership in what we are doing, in what we're trying to achieve to promote their health. And if we can do that, if we can build that trust, if we can work with people to identify their needs and to gain their trust in what we are doing, then the experience shows us that the program has a much greater chance of sustainability, that people themselves will continue the program because most programs are funded for a specific period of time. Once the program is finished, if we can build trust, the people themselves will continue different aspects of that project. Communication skills are very important in public health. It's not just about communicating to people the most up-to-date information so that they can make informed choices in their lives about health choices, but it's also about listening to what people need so that we can then include those needs as part of our program. So to me, communication involves both communicating information but also listening to people. And there are many techniques now which I talk about in the book that can be used in practice to give practitioners good communication skills. In my experience, in countries where there is an established civil society, such as in Italy, where you have a history of civil society, of community action, of community groups, of social movements, then it's much easier to work with community. In countries where there is no civil society, or where civil society is very underdeveloped in terms of the network of community-based organizations, it's more difficult to work in this way. And in that case, we then have to start to build the capacity, the skills, the competencies, and the knowledge of civil society so that we can then work with them as a key partner in public health.